Light and sound-based therapies. First, we will be talking about laser therapy. Laser stands for light amplification by stimulated emission of radiation. When we talk about laser therapy, it is also known as low-level laser therapy, or LLLT for short, or as we most often call it, cold laser therapy. Low-level laser therapy is defined as the non-invasive stimulation of tissues with light to achieve a therapeutic effect. This occurs when light wavelengths, typically red, penetrate the body tissue. There are three main therapeutic effects: decreased pain, decreased inflammation, and improved wound healing. The main indication of laser therapy deal with decreasing pain and including treating pain associated with degenerative joint disease, intervertebral disease, surgical procedures, and soft tissue injuries. Many of us already have some sort of experience with cold lasers, either from work or from treating the animals we take care of, such as Victoria after her amputation. Other indications include stimulating healing of wounds and ulcers, stimulating acupuncture points, treating trigger points, and reducing inflammation associated with stomatitis, gingivitis, and cystitis. Obviously, the main benefits of laser therapy is one that we've already talked about. It's the speeding of healing and decreasing pain. Other benefits consist of being non-invasive to the animal and its injury, being pain-free as we don't have to touch the injury, and little to no sensation being felt. Due to the lack of touching the wounds, normally no sedation is required as the animal can just lay down and relax. Only in rare and extreme cases would sedation be necessary. There are also no known side effects, and no shaving is required for the treatment site. There are a few cautions that people administering laser therapy need to be aware of. Protective eyewear is an absolute necessity for the patient and the technician, as the lasers can damage our retinas. We need to be wary around metallic and reflective surfaces, as the light can bounce off and scatter. Laser therapy should never be used over the eyes, testicles, tumors, pregnancies, growth plates, or areas of active bleeding. And finally, longer periods of time administering cold therapy can create a small amount of heat, especially on darker furred animals. Our roles as technicians are to deliver the proper treatment according to the veterinarian's directions, and then properly record and chart the therapy sessions. This slide is going to show you how to properly perform laser therapy.
See how this goes. See how this goes. Put your little glasses on. I love it. So for our settings for Wolfen, we go to our protocols. We pick canine. We have to put our weight in first. He is over 100 pounds, so we click that. We then determine what coat color and skin color they are. We have him as medium. And then we pick which setting we're going to be for our treatment, and his is arthritis. So we're going to click arthritis. We then click our target area, which is hip. And this brings us to our settings. Make sure that everybody has their safety goggles on, including Wolfen. He has his goggles on. We charge up our machine here. As soon as it gets done setting itself, we're going to be treating the hip area today. Once I click this, we have our light that shines and lets us know that we are treating the area. And we're going to be treating the hip area. We go back and forth in a slow motion. We're going to be treating all angles of the hip. You can go in any direction. You can do circles. Back and forth. I like to go up and sometimes treat a little bit of the spinal area. Most of our patients don't mind this treatment at all. There is a little bit of heat involved in this therapy. It gets a little bit too hot. You can back off a little bit. And just use your laser.
One note to make about the beginning of the video is that normally in the settings, you must estimate the size or measure the area you are treating. You can also view and change the duration of treatment and/or how many joules are being administered. Once the therapy is complete, make sure to shut off the machine and put back all the equipment in its proper place. The next half of the video will be covering therapeutic ultrasonography. This is defined as the use of sound waves to treat tissues. This occurs when electrical currents are applied to the crystals in the head of the ultrasonic probe. This causes vibrations, thus producing sound waves. These energy waves pass through the skin, vibrating the tissue and creating heat. As with laser therapy, there are many indications/effects of using ultrasound therapy. These include increasing collagen extensibility, increasing blood flow, increasing enzyme activity, decreasing pain and muscle spasms, and accelerating wound healing. Our book also includes a nice little chart on page 813 that describes the clinical applications of ultrasonography and their effects. Benefits are going to include being non-invasive to the patient and their injury, as well as sedation normally being unnecessary, just as with laser therapy. There are also many similar cautions to be aware of, including not being used over tumors, eyes or skulls, testicles or pregnancies, areas of active bleeding, growth plates, or over orthopedic implants. Because this therapy creates heat, warming the implants can cause severe and burn called superheating. Rules of the technician are a tad more extensive with ultrasounds. First, we must shave the area that is going to be treated and clean it with alcohol. Then, coupling gel must be applied to the area being pressed on. Make sure to administer the treatment according to the veterinarian's directions, and when complete, record and chart the therapy session. This video is going to show you how to perform therapeutic ultrasonography. As you can see, the patient is lying relaxed and comfortable. If you can kind of see it, the stifle has been shaved and more of the pink skin is showing through. The gel is then applied and small circular movements are being carefully applied. Make sure to move over the entire area, not only to treat the whole injury, but also to give short breaks to areas to prevent overheating.